the Wheels for Life initiative came about as one doctor called Dr. Jemima Karaoke, who is a resident or who is studying for obstetrics and gynecology as a master's and at the University of Nairobi, and she took her own initiative to put her number out there in social media platforms, so that any woman who needed access to go to a facility was able to call her number and she would facilitate using her own resources.
Wheels for Life actually started from a tweet. Once I noted all these discrepancies in terms of maternal health care, I went online and I tweeted, whoever needs any help would just call me. And initially I didn't have a master plan, but God opened his doors and here we are. So the uptake of that particular tweet was quite phenomenal, because in a matter of about 12 to 14 hours, there were so many retweets.
So she approached us as Kenya Healthcare Federation and was seeking support in terms of partnership and how to make it more sustainable. So as Kenya Healthcare Federation, we put together some of the partners that we work with. Bolt is a transport company that willingly stepped on board and said, look, we are here. We are able to offer 500 rides in the initial phase. We got into a partnership with rescue.co, who are a platform that mobilizes ambulances all over. We linked up with the county government of Nairobi Metropolitan Services, that were also looking at improving the access to care for the expectant women within their county. And we also linked up with Telesky, who are the call center provider. And the number that we were given under the Kenya Private Sector Alliance Partnership was 1196.
We have a capacity of up to 60 agents, and have a capacity also to operate 24 hours. We're currently having campaigns running throughout 24/7. Yes, and depending on a project that we have, we recruit depending on that. We have a space that can actually carry up to 60 call center agents. When we started around end of April, we were having, the calls were not so many. Some of them were even prank calls, so that is why we are very important. We are like the gate pass. If we get any pranking calls, we don't forward them to the doctors. So we only forward calls to the doctors of patients, people who really need to get advice from the doctors.
Fundamentally, one of the achievements of this partnership, or of this initiative, is a significant reduction in maternal mortality, especially during this period. So we hope to be able to extend this reach and extend the benefits of this initiative beyond the Nairobi environs across all other counties. And as generally known that resources are limited across the different partners that are involved in the initiative. So definitely we would be looking forward to get more support from other well-meaning organizations that we can, to ensure we have this initiative go broader across more locations. Yeah, as a socially responsible organization, we felt it made sense for us, based on limited resources and the fact that there was a need for it, to provide that solution for expectant mothers, as we consider them as a disadvantaged segment of the community, especially during this time. That's the basis of the partnership. We hope that we're able to have this support or this partnership go on well beyond the curfew period. And then we also hope to have this partnership spread across other locations outside of Nairobi, into other counties all across Kenya, to provide or continue to provide free rides or free transportation for expectant mothers that want to move from their houses to their places of primary health care.
We sacrifice ourselves to do this work to help the mothers, anyone who could not afford maybe ambulance, but for this one it's better. At least the trip might take 10 to 15 minutes from the picking point of the client.
We started back in 2016 because we realized that response times for ambulances often took 3 hours. And so the consequence of that was that oftentimes people lost their lives, whether it was from a road accident, whether it was from a heart attack, whether it was a mother trying to get to the hospital. But there was hundreds of ambulances that existed across the country. And so what we have done over the last several years is to centralize all of those ambulances under one single system, such that when we get a call, we know exactly where the nearest ambulance is located and can dispatch that in minutes. And so rather than 3 hours, we're now able to get there in minutes, with the fastest response time being 2, 3, and 4 minutes, beating sometimes even global records as it relates to response times.
We work as a team of 8 dispatchers. We work 24/7 every single day of the year. We are all medically trained, and our primary job is to answer emergency calls, triage each and every call, and based on that we are able to send the appropriate team to respond. Rescue.co operates the largest network of ambulance providers in Kenya. And through our FLAIR technology, we're able to see the closest team to the scene of the emergency, and we're able to respond to the appropriate and closest emergency service provider.
The physician who receives an emergency call then triages the pregnant lady, and if she's stable and has no complication and needs just a means of transport to the hospital, she requests a taxi on behalf of the woman, and if she has any complication or is too close to delivery, the call is then forwarded to rescue.co. Here at rescue.co, we are able to contact the patient and we journey with her through the part of delivery, then the labor, while the ambulance team is headed her way. We have been able to deliver at home, we have delivered in the ambulance, and we have successfully transported the lady to the hospital of choice.
The calls that come to our dispatch centers, these are very serious cases for which, were it not for the ambulances, we're speaking of either we're losing the mothers, that is, we'll be having more maternal death, and also the neonatal death will have gone high. For the last 2 months, we've handled 92 cases with an average of 4 to 5 cases a night. And remember, when I was saying the 92 cases, these are the very serious cases that required an ambulance transfer. For all our ambulance partners, the ambulances come and they're very well equipped. They're capable of handling a delivery if it occurs, and they're also capable of handling any complications that can occur in the ambulance. So the FLAIR system allows you to get contacts for various hospitals. And in this situation, it allows you to coordinate for the patient transfer. We not only just carry these women to a health facility, but we make sure that we transfer them to the right hospital type. For example, there's a case that we responded to for a mother who had called in from Kayole. This is a mother who was going in shock. She had high temperatures. She was unresponsive by the time of call. So we were able to use the FLAIR dispatcher to get the right facility. We were able to connect them with the ambulance team, and eventually this mother was transferred to KNH. And as we speak today, the mother was operated on the very night we transferred her. She gave birth to a live and healthy child who is still admitted to the neonatal birth unit to date. Were it not for these Wheels for Life, as we all understand how complicated maternal health is, it will have been a different story.
Nilikuwa nimefika mwisho, sijui ningefanya hadi hiyo siku. Nilikuwa nimeambia jirani yangu tununue tu wembe aniokolee tu hapa kwa nyumba, sababu sikuwa hata na sumuni na maosi ni pesa, kuna curfew, watu hawatoki.
Any mother who comes in, being that she's coming in for the first time to deliver, we receive this mother. Coming in to deliver for the first time, it's not an indication that we should not admit you. We admit the mother, take her through all the process of labor until she delivers. We admit also mothers. Sometimes mothers come with the BP which is slightly high, we still receive, but if there is any indication that we should refer, that is when we refer. And as you have seen, we have a standby ambulance which work in 2 hours of our maternities. That is when we can refer. Before Wheels of Life, we had issues. The number of women delivering at home, the numbers had increased. And you see, with the whole delivery and skilled delivery, people who are not qualified, anything can happen to the mother. There are a lot of complications which can happen to the mother and the baby. But now the mother is assured to come and receive skilled delivery, and that is a joy. We now don't register home deliveries the way we were registering when the curfews just started. So we are really happy because we are assured whatever we are told the mother is able to come. So thank you so much for the Wheels for Life, and we would at least request that it continue, even if curfew is over, because mothers are not able to travel at night because sometimes of the transport issue. Let it just continue to save mothers at night. This is our ambulance, our standby ambulance, just in case we have any client who develop, any mother who develop any complication, we are able to refer to Mama Lucy, because there they have a theater and they also have doctors. They can at least be able to take care of the mother if they have any complication.
Now, when immediately a client arrives in maternity through Wheels for Life, this client will take a maximum of 20 minutes for triaging and examination. After that is done, the driver for Wheels for Life will come with a work ticket or that form to be filled, where the nurse who examines the client will fill this form and return back to the driver. During the time of COVID, in the month of March and April, we had patients drastically drop from 189 to 114. And we can say thanks to the Wheels for Life, because during that time, mothers were delivering at home, coming here with complication. We can say we had a total of mortality, perinatal mortality of 4, that was abnormal to Makadara. So you find if these mothers comes through Wheels for Life, it's a benefit for the mother and the hospital too, because this mother goes through the doctoring, where this mother is screened by the Wheels for Life doctor, and for her to come here, she's already fit. And like that time that this mother would just come and maybe had lost the baby without knowing. During the Wheels for Life transportation, you find the client will talk to the doctor, who will choose the patient where to go to. And like the patient will have an option for herself where to go and deliver. So I think it can be an input, the patient will be given a priority to choose a place to go as she wish. Now, going forward, what do we envision? Number one is access to care is a big issue. So you can imagine, since we started, we've received over 1,500 calls. We've served over 500 women who are expectant, and that shows that this is in slightly more than a month. It shows the need that is there, that within Nairobi County, we normally estimate that every expectant mother is within 5 kilometers of a facility, yet they are not able to access it during that space. And if you project this to other counties like Isiolo, Marsabit, the vast counties where the facilities are very far off, you're complicating the curfew not just by the time but also the distance. We are hoping, we've reached out to partners like UNFPA, we've reached out to Beyond Zero Initiative, which is by Her Excellency First Lady Margaret Kenyatta. We've reached out to partners like Safaricom and others to see how to grow this and make it sustainable, because the issue of access to a facility for expectant mothers is not just because of the curfew, but many other factors come to play, and these delays in seeking care are resulting in complications to both the mother and the child, or either of them.
All right, so the Wheels for Life initiative has come quite far from a tweet to now having so many partners and reaching so many hospitals and patients in and taking them to hospitals. It's been quite amazing, but we also realize there's need away from Nairobi County. There's need across the whole country, because we still get calls from as far as Samburu County and someone is in neighbor, and we will try and get an ambulance, but it's not as easy as if we had already had the platform covering the whole country. And even within Nairobi, where we have seen we have more of a catchment area, if we could have already positioned ambulances and taxis, it would really make it faster for the women to get to hospital. And so we're creating a system where it's easier for the women to get to hospital no matter the hour.
Venye nimesaidika hivi, hata mi siku moja nitapatia mama mjamzito hii namba, na wapigia au simu na wamsaidie, na nitawaelezea hao mama wajawazito kama wenye walikuwa wajawazito kama mimi. Hiyo namba wakipiga watasaidika, na si ati ni watu wa uongo, ni watu wa ukweli kabisa, na wamenisaidia na nimeona na macho, na si ati ni kitu yenye nimeambiwa.
So we are looking at a future where each and every expectant mother will have access to a facility, and so the delay will not be because they did not have the means to get there. We are seeking for partners. If you're interested in supporting the initiative, you can reach out to us through email, that is wheelsforlife@khf.co.ke, or even call the 1196 if you forget the email address. We'll be able to get you in touch with one of the partners who will have that conversation with you. But our overall goal is to uphold the initiative that says no woman should die giving life. So since then we have delivered over 350 babies, and we are very happy that these babies have been able to access care because of the initiative of the partners who've come on board, and we do share our appreciation to everyone who's been pulling their weight to ensure that no woman dies while giving life.